Hi, my name is Steuter. I'm an invasive cardiologist here at Bryan Heart. I specialize in advanced cardiac imaging and heart failure cardiology. I grew up between Valentine and Ainsworth up along the Niobrara, a beautiful scenic area. I was fortunate, to be there and have all those experiences growing up. I think helped fold me into who I am today, develop a hard work ethic, very much tied to the state of Nebraska and to the small communities in Nebraska because I think they're important for the state. My interest in medicine actually started when I was a freshman in undergrad, studying a little bit about stem cell research. That's what led me initially to choosing a field in medicine. Well, after high school, I attended the University of Nebraska here in Lincoln. I then took a job here at Bryan, worked on the cardiac floor, and became very interested in cardiology and knew that that was the right fit for me. After that, I went up to UNMC in Omaha, where I completed my medical school and stayed there for my residency and fellowship in cardiology. Being a cardiologist, you have to use a lot of different skill sets, and one of the most important things is, well, one, being good with your hands. I grew up on a ranch in western Nebraska and always was mechanically kind of inclined, and so I think that's an important set to have. Probably the other important set is patience and calmness as a cardiologist. Every day we have very sick patients, and there's a lot of stressful situations, and you have to be able to rise above that stress and stay calm. I think the most important thing about the relationship between a patient and a provider is that there's mutual trust and comfort. A physician's never really going to be able to completely understand a patient unless they trust them and they're comfortable with them, willing to tell them all their symptoms that they have, all their problems that they're having. So I think it's very important that a physician and a patient have that mutual trust and that mutual comfort to make sure they get the best outcome. One of the ever-growing fields in cardiology is imaging and advanced imaging, being able to see the heart better than we ever could before, being able to better diagnose a patient with a specific disorder. Here at Bryan Heart, I'm lucky that I have the resources that I can perform cardiac MRIs, as well as we have an advanced cardiac scanner that allows us to get amazing pictures of the heart. We're the only institution in the city that offers cardiac MRI, as well as we're the only institution in the state that actually has a 256-slice CT scanner. So using both of those, allows me to better define my patients, to better diagnose my patients, and overall gives them the best outcomes. There's no question that in medicine, teamwork is one of the most important things for a hospital to have amongst their employees. I was able to find a job where it allowed me where I had the support of the administration to develop a program and where I have the financial support to do these advanced imaging techniques that we have here. As well, I'm surrounded by a great team of partners of cardiologists. A lot of them have Nebraska ties and really care about the Lincoln area and really care about the state in general. So I think that just goes to show that the hospital and our group is committed to providing the best care in the region for our patients.